It's still good morning, Nigeria. On cholera outbreak put together by our correspondent Garbanata Ada.
Earlier, 5 persons reportedly died and 60 people were hospitalized in Lagos for severe outbreak of cholera, otherwise known as gastroenteritis. Recently, Lagos recorded 21 deaths and Nigeria has recorded about 1,314 cases, which has now become a source of concern as the epidemic continues rising. 10 states that have contributed to 95% of the burden are Bayelsa, Zamfara, Abia, Cross River, Bauchi, Delta, Katsina, Imo, Nasarawa and Lagos. However, statistics indicate that top states affected include Lagos with 401 cases, Bayelsa with 442 cases, Abia with 109, and 50 cases from Zamfara, and less than 50 cases in other 30 states across the country, according to the Nigerian Center for Disease Control and Prevention. Health experts revealed this necessitated a public advisory alerting the public of increasing tendency of cholera outbreak across the country as the rainy season intensifies. Cholera is a highly contagious food and waterborne disease. It can be transmitted through drinking or eating contaminated food or water. Due to poor sanitation and lack of hand washing, one can contract the disease. Health experts also revealed the symptoms of cholera, which include diarrhea and vomiting or may be associated with nausea and fever. In the last 2 centuries, there were 7 pandemics, but reported in Africa was in 1971. And since then, the struggle to tame the widespread of the disease has been on. Nigerian health authorities believe the disease is preventable, but what kind of measures has the government put in place to contain the spread? What is responsible for the severe deaths recently witnessed despite preventive measures? What is the comprehensive report on the status of the cholera outbreak in states so far? All these issues shall be discussed by guests on the program.
All right. Thank you very much, Garba Natala, for that background report. And joining us now here in the studio to discuss cholera outbreak in Nigeria, let me introduce Dr. Teresa Ekaite-Nwachukwu, State Epidemiologist, FCT Health Service and Environment Secretariat. Thank you very much for coming on Good Morning Nigeria.
Thank you. I'm happy to be here.
Good morning. And also joining us from our Owerri studio is Dr. Prosper Ohayaga Success, Honorable Commissioner for Health and Social Services, Imo State. It's a pleasure to welcome you, Doctor.
Very much good morning.
I like your view there. Because shows that Imo is very calm and looking great this morning. Our next guest also joining us virtually is Dr. Abiodun Oguni, PhD, Assistant Director and Epidemiologist, Head, Subnational Advocacy, Health Security and Health Promotion, Nigeria Center for Disease Control and Prevention, NSCDC. He's also the lead National Rapid Response Team supporting Lagos State. Many thanks for joining us, Dr. Oguni. Sure, that connection will be much better. We're also supposed to be joined via Zoom from Bauchi State. We have Dr. Rewanu Mohammed, Executive Chairman, Bauchi Primary Healthcare Development Agency. Dr. Mohammed, good morning to you.
Good morning. Good morning, NTA. Good morning, Nigerians.
All right. Let's begin this conversation, I guess, from best from Lagos, where Dr. Abiodun Oguniyi is. He's Assistant Director and Epidemiologist, Head, Subnational Advocacy, Health Security and Health Promotion at the NCDC. Doc, this morning we were reading the papers, and the information is that 401 cases have been reported and there are 21 deaths. What's the status as at this morning? Is it still 401-21?
Good morning, presenters. Very good morning, Nigerians. Thank you very much for having me on the call. Confirm that that was the last data as released by the state. Thank you.
Country regarding the cholera burden that is the major issue that the health sector is battling with at the moment.
So, indulgence, when we have virtual calls like this, there is always a lag. So I didn't get the beginning part of your question. If you don't mind, if you can repeat, if the question was for me.
Yes, I just wanted a status, a situation report of where we are with the cholera burden that we have at the moment beyond the numbers. A situation report. Where are we with managing? Noise.
All right. Thank you very much. So, as we all know, cholera has always been with us. So, it's not the first outbreak we experienced. History will show us that as far back as 15th century, cholera epidemic has been characterized. And in the last in the last 2 centuries, for instance, we've had pandemics. And the current wave of the outbreak that we're experiencing in the country could be traced to 1961, that later came into Africa in 1971 and it's been here with us. Over the years, in the, let's say in the last 2-3 years, for instance, we've had incidents of cholera that are even higher than what we currently have. And so it's important to underscore the fact that we've been able to put measures in place to stem the tide what we currently have. By this time in 2021, for instance, and 2022, the cases are way much higher than what we currently report, which shows a progress in the intervention. But as it is at the moment, having seen the level of, let me say, the spread of this outbreak across different states in the country, it might interest us to know that before this period, we already have a prediction to know that these outbreaks have this seasonal pattern and this come up again. So when it's easy to relate with it because that is when the outcome of our practices, let me put it that way, the open defecation practices comes out, because the rainfall will come with sometimes heavy floods that are also being predicted by NIMET, and it washes the surfaces, it washes the septic pathways, washes the gutters, and the surfaces where open defecation has occurred, and this brings cholera bacteria, that is Vibrio cholerae, into the water streams. So when there is contamination of the water sources by this cholera, by this organism, then it leads us into what we currently have. But for us as a country, having known that this is going to come up, at the end of every outbreak like last year, we've been able to do our after-action review, which helps us to know what are the challenges, the gaps, and the best practices. And with that, one of the actions, or some of the actions we positioned, was to have supplies for cholera consumables for managing cases in all the states, especially the hotspot states in Nigeria. And with this, we expect that every state should be able to start, and that is what many of them started with when these are been able to train LGA, that's local government area, around the country. And with that, these are the frontline officers situation when it occurs. The third point is that we were able to issue advisories to all the states, like one of the advisory was what your media outlet just read before we started. So with this information, preparing the mind of the states to know that this outbreak is going to occur is one of the efforts to help them put measures in place so that they can begin to stay situation with respect to facilities that they will use for managing the cases. Their surveillance system is being improved to see that they can pick the cases. And we have a very robust surveillance system that can help us pick these cases. But if we are, okay, thank you very much. Let me pause there. I think you want to say something.
All right, Dr. Oguni, thank you so much for that update. Coming from the CDC, let's quickly get to the Honorable Commissioner for Health and Social Services. All right, looks like that connection is not, good enough. But let's come back here in the studio. Dr. Teresa Nwachukwu, I'd like you to, just first and foremost, for those who are probably trying to understand what we're talking about, just give us an overview of what cholera is about, the causes and how it presents in, someone infected with cholera.
Thank you so much. So cholera, like Dr. Oguni just said, is a bacterial disease. It's an infection that is caused by a bug, a bacterium, okay? So I use that word, a bug, so everybody can get what we're talking about. And it's a fecal-oral infection, which means it comes from the feces to the mouth. So when people stool, when people are infected and they contaminate water sources and contaminate some food sources with the bacterium or with the bacteria, then it gets into human beings. It gets into human beings and then it releases toxins. These toxins kind of open the tap of the body and then water comes out. So so that's it. It's a bacterial infection. It's taken in through contaminated food or water, and it causes basically stooling and vomiting with severe dehydration. And so the symptoms are very clear. Severe stooling, which is very typical. If it's cholera, it's very typical. We call it rice water stool. So imagine if you boil rice, if you parboil rice, and then that's soggy kind of pale water that comes out. Cholera stools are like that. So they look like rice water, and so it's very typical. And then it causes dehydration, especially in children, and it's something that can kill within minutes, literally within minutes. And so that's it. And like Dr. Oguni said, our habits, the things we do in terms of open defecation, in terms of poor sanitation, not washing our hands well, these are the things that preposition the infection to take root and to spread. And then when we even use contaminated water to wash our fruits and vegetables, we can also eat these thinking that we've washed them, but we actually, because we use contaminated water, we get infected. And so this is the simplest way to explain what cholera is about. And there's several serotypes of the Vibrio cholerae, different types. And we have some certain types that cause epidemics or outbreaks like we currently have. And so when those types are out, it's now left for everyone in the community to realize that there's a problem and link with the health system, link from the communities to the health system, to epidemiologists, and to public health officials to ensure that we're working together as a team to prevent this infection. So that would be a brief overview of what's happening in the cholera ecosystem.
Who are those more susceptible? Would you say children or adults?
So everyone is susceptible, but children would suffer more severe consequences because they lose 70% of their body fluid is gone, and then they die more easily. So everyone is susceptible, but children are also extremely susceptible, and especially those who live in areas of poor sanitation, people who have very poor access to water and sanitation services, no toilets, no hand washing facilities, no clean drinking water. These are people that are susceptible to cholera.
All right, let's put you on hold, Dr. Nwachukwu. Let's head to Bauchi, where we have Dr. Riwanu Mohammed, Executive Chairman of the State Primary Healthcare Development Agency. Dr. Riwanu, thank you for your patience. I'm sure you've listened to the guests that have spoken before you. I just want to get a situation report of this health crisis, health burden in Bauchi where you are, and how the state government is coping?
The viewers, Bauchi State actually he had the report that there's an outbreak of cholera in Bauchi. Yes, we have suspected cases. In January, we have about 30 suspected cases in one of the local government. And then I think in March, we have another 3 suspected cases, which they are not positive all. They are actually negative. But in 2021, we had a lot of cases, almost 29,000 cases of cholera in Bauchi State. And almost 10,000 was reported in Bauchi town alone, in one of the centers we are managing with MSF. And that is a big challenge at that time. So we really had a lot of crisis of cholera since 2021. And then when we assumed duty in 1999, cholera was actually the big challenge in the state. And then we actually started enlightening the public. We set up what we call technical working group on cholera and technical working group on all other infections like Lassa, yellow fever. And then we also did what we call incident action plan. Incident action plan are done to actually set and then plan with your partners what kind of work are you going to do to carry out the control of cholera. We know the time, as the Togui said, it is at the beginning of rainy season. What time are we planning to actually start this activity before the rainy season, so that all work has to be done? But my concern is the synergy between all sectors during cholera control. The NCTC is doing their best, but there is not much control between NCTC, Federal Ministry of Environment, since it's environmental disease, and then National Primary Health Care Development Agency. That is the reason why we are not having effective control. And it's a big challenge in the state here because of the terrain and the issue of lack of enough water supply and refuse disposal, particularly open defecation. It's only one local government that is local government open defecation free in Bauchi State. All other local government, the open defecation is at the highest level. And water wash all this stool into the well, and at the end of the day, outbreak starts. And you can see 2021, 2022, there was not much outbreak because we used the basin. We got a hotel.
Seem to be having a bit of a network challenge with Dr. Mohammed in Bauchi, but of course I'm sure that will get better as the conversation continues. But let's quickly get to Imo now, if the connection is strong enough. Let's hear from the Honorable Commissioner for Health and Social Services, Dr. Success. I would like you to also give us a situation report in Imo State. What's like, how you dealing with cholera, and also give us the status, as regards open defecation. Okay, well, looks like that connection is still not there, but I'm sure all of that will be rectified. So we'll come back here in the studio. We do not have a network connection with you, Dr. Ekaite, because we can see you right here. So, of course, what worries me about cholera, and I'm sure a lot of Nigerians, is the fact that open defecation is still a major problem in Nigeria. A Watchdog report says that about 48 million Nigerians still engage in open defecation. Only 8% of Nigerians have access to clean water for hand washing or even for drink, and then drinking. Of course, so many stories around that. Do you really think that we have the capacity, to stem this disease before it becomes an epidemic?
I think we have the capacity. We just need to engage more with the communities. We need to engage more with the communities. The guest that spoke last talked about the 2021 outbreak, and the FCT was part of that outbreak. We experienced that outbreak in 2021, and after that outbreak, a lot of things were put in place. Yesterday, I was in one of the communities that had a public toilet facility that was built in that community, and as I speak to you, as at yesterday when I was there, that facility is no longer working. And it's all locked up. And I think the community is waiting for the government. So the community, I was expecting, and I had that conversation with the leaders. I said, why can't the community come together and make sure that this facility is working? Because I saw the public toilet was locked up. And I asked, why is it locked? They said, oh, it's not working, water is not flowing. And I said, why can't the community, the government has put this facility there, and you could see the date. Why can't they do something about it? So there needs to be that synergy. Communities also need to take responsibilities. If you go to many communities now, you see that people step over gutters to go to their daily bread. So they're selling things right in front of them. It's a sewage line, it's gutter that is not cleaned. Now, do you think the government needs to go in there and clean those gutters? So I think communities need to, we have the capacity. So we need to engage the communities to know what level of responsibilities should you take. Even if in your local environment, just keep it clean. And if some facilities has been brought to your community, can you maintain it? What can you do to maintain it? So yes, Nigeria has the capacity to do a lot of things. It's that willpower by everyone to work together.
By the way, could you give us statistics for FCT at the moment in terms of the cholera outbreak?
Oh yes, right now in the FCT, we don't have any confirmed cases. If you look at the NCDC advisory, there's one case reported from the FCT, and that one case was reported as far back as February. And when the results came in, when we were called and our team went in, took the samples, the result turned out negative. But we had already sent in the CIF, the case investigation form for that case as a suspected cholera outbreak as a case. But that result turned out negative. So as of today, we don't have a confirmed case of cholera in the FCT. As I speak to you, we have teams out on the field. Yesterday, I was out on the field myself, searching the health facilities, going to private hospitals, asking community members, have you heard something? Have you seen something? Because right now, somebody talked about the incident management system. We have that system. We have a surveillance system that is very effective. And so now we know what is happening in other states. We're surrounded by states who have reported cholera, so we know that it's just a minute away. So our Emergency Operations Center is on the alert mode, and that means heightened surveillance. We're out in the communities, we're out in private facilities, we're out in health facilities, asking questions, responding to signals, responding to rumors, responding to alerts, just to hope that we can keep ahead of the bacteria. So far in the FCT, no, we don't have a case of cholera right now. I want to emphasize that. And we're calling on everyone in the FCT to join hands with the Mandate Secretary, Health and Human Services Secretariat, Dr. Adedola Kwafasha, where she's very passionate about this, to join hands to ensure that cholera doesn't get into the FCT. So what do you have to do? Wash hands, make sure you're using clean water to wash your fruits and vegetables, cook food well, don't eat overnight food that has not been properly cooked. You may want to reconsider buying street food at this moment until this acute phase is over. Yeah.
All right, Dr. Kaite, thank you again for the insights there. Let's head back to Lagos, where Dr. Oguniyi, right? Okay, let's head back to Lagos and engage Dr. Oguniyi. Could you please give us a sense of the state of facilities and the preparedness of personnel there in Lagos to combat what we are having at the moment with regards to cholera, which is said to be in its acute phase? Oh, we lost Dr. Oguniyi there. Is he? Dr. Oguniyi, can you hear me?
I can hear you. Can you confirm you can hear me, sir?
Yes, I can hear you. Please give us a sense of the state of facilities where you are and the state of readiness of personnel, of medical personnel to deal with the situation as it is.
Yeah, thank you very much. Lagos State sudden surge in number of cases can be partly attributed to the floods, the heavy rainfall that occurred just some days before we started having this large number of cases, and it was all over the state, and that could partly be responsible for how the
Is it my phone
contaminated
making
water
that
has
sound?
possibly found its way to different parts of the state. And definitely, if the water pathway is contaminated, and this is the same water that people use for making food, for drinking, and others, then we can understand why we have this kind of surge. But it's interesting to know that Lagos State is on top of the situation. I can report that to you without mincing words. There's high level political will and commitment from the governor's level, uh, daily making calls, working with the commissioners, or the commissioner of environment, commissioner of health, commissioner for agri, information. It's high-level incident command system activated here in Lagos. And you have all the general manager of LASEPA, that is the State Environmental Protection Agency. They are using a One Health approach. What we call One Health approach is bringing human, animal, and health, human, animal health, and environmental health all together. All the stakeholders are in the room, the partners are on ground, WHO. So it's the state is not taking this lightly at all, because the health of Lagosians is so paramount to them. And I can see that vividly on ground. Meetings are held late into the night, like 10:30 p.m., 11 p.m. I hope you can hear me. The internet could be a bit unstable. Apologies. It is what it is. As far as the facilities are concerned, the management of the cases, one of the things that Lagos State did, which is very commendable, is to declare treatment for cholera free. So as long as the treatment is free, it's easy for those who are affected, because we know that this is a disease associated with poverty. Those who cannot afford, access to good water, or other sanitary that are poorly managed. So the facilities are made available for them. They are free. All the general hospitals in the state, about 28 of them, plus the teaching hospital and other federal government hospitals, are all activated to be able to manage cases. And most of the cases that are coming in, the challenge we've had is just because the patients present late. And we know that cholera is a disease that can kill within a short time. It has a very short incubation period. So within hours of onset, somebody is losing water, is losing electrolyte, the body fluids are going. And we know that from science, almost 70% of the human body is made of water. So if this water is going off rapidly, cholera is a very virulent organism. Vibrio cholerae is a very virulent organism or germ that can produce an episode of diarrhea every 30 minutes, every 1 hour. So imagine somebody losing water every 1 hour in a large volume and is not being replaced. That is why they go into shock. And eventually, by the time they are coming to the hospital, a number of the cases that came into the hospital are brought in dead. All right. And many of them, by the time they came in, their veins where they can set lines have even collapsed. So one of the challenges is the poor health-seeking behavior of the people. And as soon as the government got wind of this also, they have intensified efforts in community engagement, house-to-house sensitization, using all the structures in the community level, the patent medicine vendors engagement, and all the relevant stakeholders to ensure that people can come out early and get treatment, because it's a disease that is easily treatable. There are prepositioned supplies, which NCDC also supports, and WHO, all the relevant supplies for managing the cases have been made available. The environmental surveillance team are going house to house. They are testing waters. They are decontaminating the affected communities as we speak, since the outbreak started. They've activated that high-level incident management command system, which is getting the full support of the governor on daily basis for it. So I think that is also responsible that despite the Salah break, Salah holiday with all the heating, the whining and dining, you can look at the curve of Lagos State, the epidemiologic curve of Lagos State that describe the cases, that it has not gone as high as it was before the Salah break. Even today is already Friday. And so it's a testament that the state is really up and doing on this regard, and we really commend them for this effort. There's a lot of political will, technical expertise on the ground. They are working across all sectors around the clock. The state leadership, many of them were even Muslim, did not go for Salah break. They were on the field. So it's very commendable that Lagos State is on top of the situation, and they are receiving the relevant support from partners. Of course, NCDC is on ground to continue to protect the health of Nigerians, including Lagosians.
Yeah, I'd like to stay
I
with
hope.
you on your comment on cholera being a disease of the poor. We know that cholera can also be termed as blue death, considering how it kills and all of that. When you say disease of the poor, I'd like you to, to explain properly because, we know that even the wealthy, if you like, the average in Nigeria, only very few have access to really clean water, not necessarily because they are poor. It's just because, water supply in the country is not, everybody, you have to drill your borehole, and then it depends on how it is drilled. I hear that if it's not deep enough, you could still have fecal matters from soccer waste close by move into your water, but and all of that. So just explain that. And then I listened to the Commissioner for Health, Lagos State. He talked about the fact that the strain, causing cholera in Lagos State is very aggressive, and he gave some terms about it, and that's why it is spreading very fast. What are you doing, and explain this strain to us? Is it that there are different strains being found in different states, or it's a particular strain that is being circulated all over the country at the moment?
Very great questions there. So let me start with the last one so that I don't forget. Now, Dr. Ekaithi mentioned earlier on that Vibrio cholerae has serogroups. That organism that is causing this, the bacteria or the germ that is causing this disease is called Vibrio cholerae. Now, there are about 206 serological groups, like family members of this disease, of this organism. But of these 206, only two serogroups are known to cause outbreak. Others can cause mild abdominal upset and all that, but only two of them can cause outbreak. And is somebody talking? Okay.
Go ahead.
And I hope you can hear me. Can you confirm you can hear me?
I can hear you,
Yes.
Dr. Oguni. Go ahead.
We're hearing
Two
you.
of them that are known to cause outbreak and they have been responsible for outbreak in the last couple of decades are the ones we call the Serova 01 and Serova 0139. Now, those two have been responsible for outbreak, but in recent time, it's only the Serova 01 that is a very virulent organism that has been responsible for this. And I tell you a bit more about this, and it will help Nigerians to understand why we are still having this outbreak. This particular group of bacteria, they are very virulent. So they also have what we call the biotype, the biological type, which describes their function. And by their function, we are saying the ability to to release toxins. Toxins are those things that they release when they get inside the intestine of human being and cause all the damage that they need to do. They are also described based on their ability to survive in the environment. This organism we are describing this morning can live in the environment for weeks, for months, for years. They can go into what we call dormancy, meaning when the weather is hard, they deactivate their functions and they can survive in water, in the dry land, in temperature that is 10 degrees or 40 degrees. They can survive in salty water, in fresh water. They can survive in the skin of human. Plastic waste that you drop on the streets and everywhere, they can survive on it. And as soon as the situation becomes favorable again, the rain comes, it washes it and it finds its way into human being, they activate their functions. So when they get into human being, the first thing is that they rehydrate themselves with the water available within the small intestine. When they do that, the next thing is they activate all their functions and they start causing their damages. And with that, with more organism being produced, because every diarrhea, every stool that is coming out of a cholera patient contains thousands and thousands of these organisms that are being released with every episode of that diarrhea. And so they continue to contaminate the environment again, and the cycle continues. So for an organism that also has the ability to protect itself from sun radiation, it can protect itself from extra harsh condition. It is a very serious organism, and that is what is in circulation. That is why it's responsible for outbreak. So the commissioner said it very correctly. That is the strain we have in the country. The biotype, the serotype, they are those ones that are known to be virulent, and causes a lot of damage in the system. That is the fourth part of the question. So when you have this organism that can survive on human skin, that can survive in the environment for long, you can see that as long as people keep continuing with their, and that leads me to the next question you asked about whether it's a disease of poverty. So when people, you find out that the slums, statistics some have quoted that about 50% of people living in Lagos are possibly not having that kind of comfortable apartment that gives them the opportunity for access to water that is portable for them. You know, Lagos is built on water, so to say. Of course, a good part of Lagos is surrounded by water. And when you have that kind of situation, there is tendency to get exposed. And so you find out that where this outbreak started from, in Lagos Island, for instance, we have majority of the cases are, you will find those settlements that are not optimum for living, so to say, compared to people who are living in highbrow areas. And that's why you hardly find that disease starting with the rich settlement. You find out that it will start with those who are living in places around gutters, dirty environments, who are not keeping their hygiene. So when we say it's the disease of the poor, it's related to their ability to have access to good housing conditions, their ability to have access to good water conditions because of where they are staying, and they themselves too, they are not able to afford the basic livelihood that can even boost their immunity so that the disease doesn't come down, bring them down. Because more than 60% of those who will have cholera will not come down with the disease. The immune system is strong enough. So for them, they are also not well fed, nutritional issues are there are deficiency, and so they can easily come down with the disease. And by the time one person comes down with it, he spread it to everybody in the family, contaminates the environment the more, and that can continue. And there are also the people that cannot easily seek care because they don't have the money. And that's why it may also result to death. And that's one of the beautiful things Lagos State has done to make treatment free for everybody that has this disease. Don't bother to ask questions, just come. The facilities are there, and they're also decontaminating their homes, chlorinating the water. Because one of that thing is that they are being educated, all the affected areas, on how they can purify their water, how they can make it safe for consumption so that they don't drink contaminated water. And with that, we start reducing, and you see the cases are going to keep coming down in the coming days. So basically, it's the disease of the poor. It's associated with poverty, water issue, sanitation issue, hygiene issue, coupled with nutritional challenges that could also bring people down early if they don't seek care. That is what we mean by that. Thank you.
Dr. Oguni, thank you very much. We'll come back to you. Let's head to Bauchi, where Dr. Rilwan Mohammed is. Earlier, we had asked you to give us a situation report on the cholera outbreak in Bauchi, but we will allow you to round off your thoughts. And while at it, you may want to also tell us what challenges, if any, you are having with containing the disease.
Thank you very much for coming back to me. And I just want to say that we have only 30 suspected cases of cholera. We don't have confirmed cases. That's number one. I hope you are not hearing me well before. And then we actually set up a rapid response team at the state and local government level. And we're meeting twice in a week. And we knew that this is at the peak of the rainy season. And we expect the outbreak of cholera to start in the state. Since 2021, we're having some pocket of outbreaks. And last year, we had few outbreaks. Now, the rapid response team, the surveillance system at the state and local government has been activated. The rapid response team has also been activated at the local government level. The surveillance system, the pillars has also been activated. Surveillance pillar, case management pillar, and we also have the risk communication. One of the things that is important to us in management of cholera is information. You don't give information to public, we're in trouble. Now, we have started sending jingles into radio, televisions, community radios, and then our town announcers are going around to inform the people, look, there is an outbreak of cholera in the country. If there's an outbreak of cholera in Lagos, already there's an outbreak of cholera in Bauchi. So we don't want to wait. It's about 30 states are having outbreak of cholera or suspected outbreak of cholera. We have to start planning, and that's what we did there. We put the technical working group at the NCDC level and at the state level. We are already working and having meeting twice in a week. Well, we have meeting before once in a week to actually look at what we have and where are the problems. And you can ask this problem of cholera can be from the government also. The whole of Bauchi state, we don't have public toilets. I just had a small diarrhea just after eating salad meat. I was looking for a place before I reached my house. There was no public toilet to pay money and go in. So people at the open defecation is also resulted from the government side, the politics from the government side, at the state, local government level, and federal government level. The only place where we have public toilet is in the market or in the motor parks. And they are very careful about doing that because people are coming together. They pay a token amount of money to defecate. And that will reduce the outbreak of cholera in the country. It's very important that we do that. And then one thing that we also realize is that we bought a lot of chlorine to decontaminate all the well in Bauchi. His Excellency the Governor of Bauchi said gave us about 8 million to buy chlorine and also carry out rapid response decontamination of all the well at the state and local government level. We already did the mapping to chlorinate all the wells to prevent the outbreak to occur. We don't have a case, but we hope we are going to contain that, and we want to appeal to NCDC. The RDT that we are using to actually carry out the test, know whether it is a confirmed or not confirmed case, we only got 100 from NCDC. And then I think that we need to get more because Bauchi says about almost 10 million now. And then people are coming from all walk of life because of the crisis in plateau, crisis in the northeast. Bauchi says it's the second one. So a lot of women are coming in. We have a lot of outbreak in Bauchi because of this kind of condition. It's congested. People are living in Bauchi, and then the little what do you call it? The facilities that we have in the state level, the health facilities are also being congested because of that. So I want to appeal to the NCDC that the synergy between NCDC and MPSCD is key, and then the Ministry of Environment. So, and the Ministry of Agri, the so-called incident one health, is very important in containing the outbreak, not only cholera, so that we are working with one voice. And I think I want to congratulate and thank NCDC for actually promptly talking about this cholera, so that we will not sleep, and many people have died by now because we are trying to see how we can contain it. All states are now waking up, and then NTA is also, you can see that we are now discussing and informing the public. One thing that we must do, and we must inform the public, is about hand washing. We don't wash our hands after eating, after going to the toilet, we are going to have outbreak of cholera and other outbreaks.
Thank you so much, Dr. Mohammed, Executive Chairman, Bauchi Primary Healthcare Development Agency. And thank you for the clarification as regards not having anyone with cholera in that state, but suspected cases. And we hope it remains that way. Let's get back in the studio now. Dr. Nwachukwu, I would like you to, you said in the FCT, of course, no reported case yet. But I want you to speak about the health facilities and then the medical practitioners themselves. If we have the capacity in terms of infrastructure, and in terms of well-trained medical personnel to handle this. I'm talking about in other states now where we have an outbreak. And then also want to speak to us about a vaccine. I think I saw a report yesterday about a vaccine and all of that. So could you give us that?
All right, so let's talk about the human resource for treatment. I think that's one of your first questions, and it's a major critical issue because everyone knows what's happening in the health sector in terms of human resource for health. There's a critical shortage of people to work in health facilities. When you go to the primary health center, you're seeing volunteers. When you go to secondary health facilities, sometimes you're seeing just one or two doctors, maybe one nurse covering a round. So, and one of the things that the current mandate secretary is doing right now is being to see how she can mobilize volunteers in terms of health professionals who are in other sectors, who are not in health facilities, to go into health facilities and beef up the capacity. She actually gave an experience where she went to a facility and there were just not enough hands because of the attrition, the JAPA syndrome that has happened. It's huge and it's massive. So that's a real gap. And so what the mandate secretary is doing right now is mopping up human resource doctors and nurses who are in other sectors to go into facilities, maybe on a volunteer basis, to help and to beef up the capacity. But in terms of the quality of the doctors, the quality of the nurses, the FCT has the right quality, the right set of people who know what to do. What we just need is the numbers. We need the critical numbers to be there on the ground to respond. And then you talked about vaccines. So yes, there are oral vaccines. The vaccines against cholera are oral vaccines. And the vaccines are available. But what happens is that you have to know the serotype that is circulating. So Dr. Guni just talked about in Lagos, what is circulating is 01. So which means the vaccine that goes there will be against that serotype. So what is important is that tests should be carried out. It's one thing to say, oh yes, somebody will suspect it's cholera. It's another thing to actually test the stool and confirm. So once you do a rapid diagnostic test, and you need to go further to take that sample to culture and actually grow the bacterium so that you can know this is what we're dealing with. That's the only way you know the serotype that you're dealing with, and then you can tailor the vaccine against that. That happened in previous years. And so you notice that once you are vaccinated against a serotype, the next outbreak, it's not that serotype. And that is one of the things that shows that vaccines actually work. Because when the next outbreak comes, you see that it's completely different from the serotype that caused the previous outbreak. So vaccines are available. You have to have the right serotype, and then you demand for those vaccines. And remember, it's not vaccines.
So the vaccines for cholera should be on demand. Why is it not incorporated into the vaccination schedule that we have in the country?
So because cholera outbreaks happen sporadically. So it's not, like you said, it's seasonal, so it comes with the rains. And so you prevent. So once you take the vaccines now and you spread it around, you find out that in the next season, you won't have that happening. Again, you have to test. And remember that vaccines is not something you can go and buy. You have to, at a country level, ask for it and get it done. So vaccination is going on. Lagos is vaccinating, and different states, I'm sure, are vaccinating.
All right. Let's get to Imo State now. I just hope the connection is better now. Dr. Success, if you can hear me and see me clearly, I'd like to find out from you. Of course, the conversation has gone a very long way, but of course, you could fill us in on what's happening in Imo State as regards cholera outbreak, number of cases, and then number of deaths so far, if you have any.
All right, good morning. I'm sorry about the network. It's been quite challenging this morning. From January to June, the state recorded about 28 suspected cases of cholera, and all of them tested negative on rapid diagnostic tests. And we had more of female to male distribution of these suspected cases, and we had more with children under 5. We had about 2 cases with children 5 to 10 years, and we had about 5 cases with children 11 years and above. And then we had these cases spread along local government area distribution. We had about 7 local government areas that were affected, but all of them tested negative. So I must tell you that in Imo State, there is no outbreak of cholera. But you know that as Igbos, we are travelers, we are businessmen. And the more we travel, the more we are on, and once we're on transit, the more we are buying things on the way to eat and everything. And bear in mind that it's not everybody that's
Right. I just hope that we can, be able to hear Dr. Success, properly before we end this conversation. Now, just to quickly get to you, Dr. Onwachukwu, you talked about the vaccine, of course, which, a lot of people need to be more aware of because, just very few people know that there's a vaccination. Then, so far, we've been hearing all the doctors so far that have spoken of talking about suspected cases. So, are there other illnesses that present like cholera that could be mistaken for cholera?
Absolutely, absolutely. Simple food poisoning would lead to stooling. And so if that happens, especially in an outbreak situation, you must suspect that, okay, could this be cholera? So, so food poisoning, the rotavirus, diarrheal diseases. So there are lots of things that could present. Anything that would cause diarrhea in this moment, you must suspect cholera. So the idea is to have that high index of suspicion. Anybody comes in, don't say it's teething. One of the challenges with mothers would say, oh, the child is teething. So you don't want to say the child is teething. You should suspect. So just have that index of suspicion. It helps us to stay ahead of the infection. So once we suspect, then it allows us to tailor our management, especially to test, and then to institute treatment. And then once you test, then the result comes out and you're happy. You can say, okay, fine, this is not cholera. But the idea is to have that high index of suspicion and to think about it, to keep it in mind, in view, so that you're not caught unawares. So, yeah.
All right, but are there advices you may want to give with regards to how we tackle this in the states where it is prevalent?
I think everyone, Dr. Rilwan has talked about it, Dr. Guniyi has talked about it. First of all, know that there's a cholera outbreak, even if your state is not experiencing it right now. What do you need to do? Your water source. So if you're taking water from a well, ensure that it is decontaminated. Ensure that you have some chlorine taps. And this is something you can easily pick over the counter from your local pharmacy and add them to your water. You can boil the water. You can ensure that your fruits and vegetables are washed with clean water. So don't just assume that just because somebody rinsed it in a bucket. I mean, we've seen videos of people washing fruits in gutter water, right? So once you buy anything, wash them with clean water, cook your foods well, wash your hands after going to the toilet, wash your hands after changing your baby's diapers, wash your hands after you have been in contact with someone who was sick with the diarrheal diseases. So these are basic and simple things that don't cost money, that everyone in the community can do. And so then spread the message, tell people about it, have a high index of suspicion. And if somebody is stooling, don't keep them at home overnight. Don't say, because what happens with cholera is that the stooling is effortless. So the individual doesn't even know. So they're sleeping and they're losing this fluid and they're slipping into unconsciousness. That's one of the things that happens. So you go to wake up somebody in the morning and you find out that they're in a pool of their feces because they're gone. So if somebody is stooling, don't say, oh, let's wait till the morning, right? Take them out to get help immediately. And don't forget your simple ORS. Your local pharmacy has those sachets. Get a sachet of UNICEF WHO approved ORS in a liter of water and drink. If you don't have that, salt and sugar, 10 of sugar, 1 of salt, it's better than nothing. Don't forget zinc tablets. If you're in the healthcare center, they will naturally prescribe some zinc tablets to support you to recover early. And of course, if it's cholera, antibiotics will be given to the individual. The important thing is to seek help, to eat well, to watch what you're eating, just the basic hygiene that we've talked about today.
All right, you didn't mention prayer houses, Dr.
Prayer houses.
Should they consult prayer houses at this time?
So, you can pray, but please go seek for help.
In a medical facility.
In a medical facility. That doesn't stop. God is everywhere. So you can pray while you're in the hospital and while you're in your primary healthcare center. Yes, keep praying, but please don't go there for the treatment of cholera.
All right. Thank you very much, Dr. Nwachukwu. Let's head to Imo again. Dr. Success, we've had a hard time getting you to really talk to us this morning, but now that you've confirmed that there is no case yet in Imo where you are, what are you doing over there to ensure that the situation remains the same?
Well, I hope I'm going to be quite successful speaking to everybody now. The truth of the matter is we have ongoing active case search in all the local government areas. Remember that we are Igbos and we travel a whole lot. And when we travel, we can also, get in contact with food contaminated by Vibrio cholerae or water contaminated by Vibrio cholerae. And most times, you know that most people who get in contact with this might not actually fall ill, but they will still be shedding out the bacteria and also be contaminating the environment or infecting people. So we are doing active case search. Our surveillance team, our disease notification officers are all there to make sure that we don't have any active case going on. And once there's an active case, the patient starts treatment immediately. We've trained our healthcare workers. Our frontline workers are all trained, and we are also engaging the state mobilization officers about sensitization on cholera. And also, just like NTA is doing, every media house is being sensitized. We are going to every media house. It's a corporate social responsibility of these media houses to help us sensitize the populace on the proper hand washing techniques, on open defecation, on sewage systems, so that we don't have issues of cholera outbreak. Thank you.
Right. Thank you so much, Dr. Success. We'll come back to you, but that's after this break. Stay with us. All right, welcome back. It's still Good Morning Nigeria, live on the network service of the NTA, and our conversation is around cholera outbreak in Nigeria. Our guests are still very much with us, and I'll head to Bauchi now, where we have Dr. Rwanu Mohammed, the Executive Chairman of the Bauchi Primary Health Care Development Agency. Dr. Mohammed, looking at statistics, in Nigeria, cholera actually caused twice as many deaths in 1 year as COVID did in 2 years. And looking at the outbreak in 2021, where we had about 111,062 suspected cases and about 3,604 deaths. There's reason to worry at this point in time. What would be your recommendation, in terms of long-term solution, in order to handle future outbreaks and even the current one we're currently experiencing?
Well, I would just want to say that the Honorable Minister of Health and Social Welfare should know that just like defense budget in America and England, they're talking about very high defense budget. They're looking at your strength. The NCDC is, when the executive director he visited Bauchi State last year, he told us that the budget for NCDC is only 2 billion, while in primary healthcare have 16 billion budget. So the NCDC is being suffocated of funding to carry out activity throughout the country. And there are a lot of outbreak of disease, particularly yellow fever, cholera, Lassa, measles outbreak. In the whole of this year, we are having outbreak in Bauchi and other places. The NCDC need to be empowered with funding, and so that they can buy a lot of supplies, and then they're only coming to Bauchi to actually give us technical support. Training. They will bring only small supply because they are suffocated with funding. So in America, they are talking about defense budget to protect themselves. The NCDC should be protected and give them funding to carry out this work they are doing at the center, so as to monitor this process. And the technical working group is already being set at the NCDC. And then at the state level, we are doing the same thing. And then at the local government level, the technical working group has been set. So we should also do, before the next outbreak that occur, we'll have planned the what you call the incident action plan, which we have done in Bauchi State. And our supplies are already intact. All our partners brought their supply in one place. And then we plan what to do any time there's an outbreak. The MSF is actually trying to and waiting that is there any outbreak. The action against hunger is even waiting. Why is the outbreak now? Has it occurred? We really appreciate our partners during this activity. But our own organization, the NCDC, the MPSCD, on the other hand, has been funding. The budget is so good. And the budget of NCDC is a chicken chain. I just laugh at him. I said, this budget cannot control infection in the country. So we need to look at the reality on ground. The outbreak is getting more and more because of the economy because of the sort of inflation that is going on. People are getting more poverty in the land, a lot of trouble, a lot of water supplies. People, even the such water that is very cheap, such water that you can buy and drink, is now it's an essential commodity now. Also, household cannot get such water. So it's we're really in a big mess that we need to look at this kind of outbreak of disease where it is preventable. All the ones that we mentioned are preventable. I think I will commend NTA for actually always coming to enlighten the public about the disease that's preventable, and that the government should also come to align with their responsibility. We should also take in along our leaders, our religious leaders, and the people here are religious leaders more than our traditional rulers. We need to inform our religious leaders during sermon. They should talk to the public about cleanness of the environment, cleanness of the water they are going to drink. If they're doubting of the water they are taking, please, they should boil the water. It's very important that even if you are looking for something to boil the water, the whole of the town, they cut all the trees. They are using firewood and charcoal. I don't know one day when we are going to look for air to breathe, because all the tree has been cut down, because the cooking gas is very expensive. Government should be aligned to their responsibility to support, and the public should also try to support the government by not dumping refuse anywhere they want to dump refuse. They dump refuse anywhere they want to, and then there's outbreak, there's a flooding going on in the community. People are now sunk, and the people are dying and then getting infected with cholera and other infections. It's very important that we should enlighten our public about cholera, which is preventable. The vaccine is not for lifetime vaccine. The cholera vaccine is given during outbreak, and it's only being given by the RCG through WHO. You apply, you get the supply, and then you give out. But as the doctor said, the doctor mentioned, the FCT doctor said, that if you give this vaccine, I'm sure the first thing that controls the cholera in Nigeria today is the vaccine. Because at the time we started the vaccine, 1.5 million vaccine that we got from the WHO, when we did the vaccine, all cholera outbreak came down. But it's not a lifetime vaccine. We really appreciate this enlightenment to the public.
All right. Dr. Mohammed, thank you very much for your contribution there. Let's get back to Owerri in Imo State, where Dr. Success is, to ask, since in Imo seems to be free, I'm sure we can count on an advisory from you if we say what needs to be done with facilities across the states to be able to ensure that even if it gets into any state that is currently not faced with it, like Imo, that they will be able to manage it.
Well, the truth of the matter is we need to train our healthcare workers to know how to manage this outbreak. We need to sensitize the public. The basic thing is not the treatment. The basic thing is preventing it. What is this prevention? Very simple. Wash your hands regularly, especially after defecation. Secondly, boil your water. If you don't have access to potable water, or you do, you fetch your water from an open place, boil your water often and filter your water. Buy chlorine tabs and put in your water. In 1 hour, your water is neat. These tabs are quite cheap. And then wash your vegetables, wash your fruits thoroughly before eating them. This way, you sensitize the public. People need to know the symptoms of this cholera, and people must have high suspicion index. Let us not say, oh, this is just diarrhea, it will stop. That's what most people will say. Oh, I just want my system to purge itself and it will go off. Please, any diarrheal disease, suspect it to be cholera during this outbreak. Report. Go to the nearest health facility and get some treatment. Because what kills people is not just the infection, it is simply the loss of fluid and electrolytes that kills people. So something as easy as ORT will help people. The government is doing its best to make sure that RDTs are available in all our health facilities. please, our healthcare workers should put in their best in making sure that every case of gastroenteritis, of diarrheal disease that comes to them, they suspect it as cholera, treat, take samples and check so that we don't lose people. That way, we'll be able to salvage our people from this outbreak. Thank you.
All right, thank you so much, Dr. Success. That was a successful connection to you there in Imo. Let's see if we can reach Dr. Oguniyi now. Dr. Oguniyi, if you can hear me, I'd like you to tell us where we are in terms of vaccine production. Of course, when COVID broke, there was so much talk around, Nigeria trying to develop in terms of vaccine production, to deal with, outbreaks and all of that. Where are we at the moment? And then there's a report that the EU intends to support Nigeria with about 18 million pounds for vaccine production. What is that about?
All right, thank you very much. The conversation around vaccine, it's an ongoing thing. And I think just from what the EC in Bauchi said earlier on, even the current oral cholera vaccine does not confer a lifelong immunity. Within 1 year, 2 years, 3 years, you need to take booster doses. So even though it's helpful, but the cost of sustaining them, the current production capacity is not optimum to really depend on or invest in that much in that regard, especially for a disease that there are other options that we can really explore that are more cost effective. So the right organization to engage us further on this is our sister agency, the National Primary Healthcare Development Agency, who will be able to speak more in details because this is their call. But what we know is that the government is committed to this. There are different levels of technical stakeholders that have been set up, committee working behind the scene for different vaccine production efforts in the country. But what is important for Nigerians for prevention is to let us understand that prevention is not only a moral imperative, but an economic one. We need to understand that wellness is a journey. So it is not something that you end when the outbreak is over, then you go back until you have another outbreak. We have said it times without number. If people can't comfortably wash their hands frequently, can they prevent handshake? Can they be conscious of where they touch? Because you don't know who you are shaking, the surfaces the person has touched, or whether he has used toilet and he didn't wash his hands properly. Can these things be reduced? I know there are cultural issues around this, but for a society like the other time we were talking about this disease being disease of the poor, how many people living in the slums can dig borehole, can ensure they have good access to healthcare services? So we cannot afford to complicate the already challenging economy by also allowing disease that is preventable to keep claiming our resources and even claiming life. So one, if it is possible, we may need to reduce handshake or conscious of where you touch if you know you don't have access to quickly wash your hands. But the most important thing is that as much as possible, get your hands washed with soap and water, as we have been saying. The need to sustain communication is important. Let it not end when this outbreak comes down. By the way, I like to sound a note of warning. We are not at the peak yet for this outbreak, according to the seasonal calendar for the outbreak and the predictions. The rainfall is not optimum yet. You can see what NIMET predicted. Most part of the north, maybe Dr. Iwanu can confirm how many times it has rained in Bauchi this year. Most parts of the north have not experienced their full rainfall. And so most times July, August is when this outbreak peaks. So it's not a time to relax, even if you are not reporting cases now, just like the commissioner said earlier on. 2, or let me say 3 now, there's what we call the school health program. In all our schools, so education is important. Our school children across all age groups, we need to revitalize our school health programs and make it functional. And this is a call to the state leadership to ensure that whatever happens at the school level, the students are educated and they also know how to take preventive measures, including the hard. If the children are educated, they can even educate their parents. The issue of hygiene, this is not a time to throw waste indiscriminately, because this waste will clog the drainages and you are not cleaning them. So when the sewages are blocked, the septic tank are being, some are building their septic tank close to water sources. it will become easy when flood comes to wash this thing into water supply, and it becomes a major challenge. So we need to take responsibility. And these are the issues. Education from religious homes and media houses like NTA, you're doing a great job. But our appeal is that let it not end with an outbreak. In season and out of season, please.
All right, thank you so much for that valid point. But because of time, I want to just quickly respond to this. Are hand sanitizers still encouraged at this point in time? Because all the doctors that have spoken this morning have talked about washing hands with soap and water. Hand sanitizers, would that do the magic with cholera outbreak?
Absolutely, it's still the same principle, because the content in the hand sanitizer, especially if it's properly produced, it's able to to kill the germs in our hands. That content is enough to kill the germs. The whole idea is that what the soap will do is what the hand sanitizers will do. But if you cannot afford hand sanitizers, please use soap and water. But hand sanitizer is equally effective. Some have even argued that it's more effective. But we know our people, when they hear about something now, they start increasing the prices. And that's another challenge we have faced. When they know that something is required to help prevent disease, then the market forces will just spiral up and becomes challenging for common people to afford again. So if you can produce this thing, and even chlorine, bleach solutions can also be diluted. You can ask the healthcare workers in your facilities in your area how you can use these things for purpose of washing and decontaminating surfaces, decontaminating homes. So straight answer, hand sanitizer is still very helpful. Everything that we are using during COVID, except the issue of mask, is still very useful for us, or the issue of physical distance. But the key intervention for infectious disease has been proven that more than 60% of infectious disease can be reduced just by proper hand washing with soap and water, or with hand sanitizer, as you have rightly said. So please, let's sustain the conversation.
Thank you, Dr. Guni. We will sustain the conversation, but let's quickly get back here in the studio, because at this time you don't have here in the FCT, but are there lessons we can draw from past experiences regarding cholera outbreaks that we can build on to contain this particular one, so that for those of us who do not have experience or fit in this particular episode, we can keep it at that?
Absolutely. I think the greatest lessons that we can learn from the previous outbreaks is a multi-sectoral approach, everybody working together. So when we hold our EOC meetings, we bring people from the education sector, people from agri, people from the veterinary sector. So we're not saying, oh, this is a public health issue. This is a health issue, and it is for everyone. So that multi-sectoral approach has been extremely very helpful. The practices that we didn't have as a system a few years ago, right now, every week, we have meetings together that involves everyone from different sectors. So that multi-sectoral approach and collaboration has been very useful. Also, staying ahead of the infection is you need to be there before the infection comes. And then the system itself strengthening and getting ready. Preparedness and response is very important. So you must have a system that can coordinate a response. Your surveillance system must be very strong. You should have commodities available to respond, like Dr. Guni said. So it's not running around, people are saying, I'm sick, I don't have the money. So you should preposition commodities. The risk communication, the engagement, what we're doing right now, talking to the public is extremely important. Laboratory capacity, your ability to actually diagnose, okay, this is cholera we're dealing with. So these are the lessons we've learned.
60 seconds, we are really out of time. I want you to just speak about the vaccines. You know, there are myths about vaccines in the country, especially when they are, of course, all the vaccines are being imported at the moment. Could you clear that myth? Because a lot of Nigerians think that there's a hidden agenda to vaccines. So would you also advise that for states that do not have any case of cholera now, citizens should go out to get vaccines?
So, like I said, the vaccines are requested when you have, it's a reactive vaccination. It's called reactive vaccination. So it's not something you do routinely, okay? So it's reactive.
So for the FCT, for example, with no case, should residents of the FCT go out to get vaccine now or not?
That's not what we encourage at this point. Okay. No. What we're encouraging at this point is for people to do the simple thing of washing their hands, keeping their environments clean, and having clean drinking water and sanitation and hygiene practices.
Generally, are vaccines safe?
Vaccines are very safe. If you look at the history, most of the things that have been prevented from vaccination. When we go into the communities, you can see the difference between children who have been vaccinated against measles, for instance, and those who were not.
Thank you very much.
So it shows that it does work.
Fine place to leave the conversation. Thank you, Dr. Teresa Ekaite Nwachukwu, State Epidemiologist, FCT Health Service and Environment Secretariat. Thank you so much for joining us for the conversation.
Thank you for having me. It was
All
a
right,
pleasure.
Dr. Prosper Uhayaga, success. It was eventually successful having you on the program, Honorable Commissioner for Health and Social Services, Imo State. Thank you so much for your time. We hope to have you some other time. And of course,
Thank you very much.
All right, Dr. Abiodun Oguni, PhD, Assistant Director and Epidemiologist, Head, Sub-National Advocacy, Health Security and Health Product Promotion, Nigeria Center for Disease Control and Prevention, Lead National Rapid Response Team. A very long list. Thank you so much, Dr. Oguni. We appreciate you. And of course, Dr. Riwanu Mohammed, Executive Chairman, Bauchi Primary Healthcare Development Agency. We also thank you for your time.
Thank you very much.
All right, so that's Good Morning Nigeria this Friday. Please take care of your health. I'm Henry John. Have a great weekend.
All right, and Victor Azo, stay safe and see you on Monday.